Then following COVID-19, health officials continue to discover the effects on the respiratory system and its long-term effects on its patients and their lives. Megan Mamlock has details.
When one thinks of drowning, they think of swimming, but in this case, COVID-19 is attacking your respiratory system. Respiratory therapist Sarah Schroeder explains how a patient's lungs and breathing is impacted.
What we see is an increase in oxygen needs for our patients. We also see the lung tissue becoming fibrotic, which means it's stiffer than regular lung tissue. It has a hard time stretching and opening, which also causes problems with patients' oxygenation needs.
For months, healthcare professionals were unaware of the long-term effects of COVID-19 patients on ventilators, and now they're seeing results.
Paralytics are some of the medications we use with patients, and that can cause some muscle fatigue,
causing patients to need even more medical attention.
We see that they would have some need for rehab. With that, the oxygen needs typically do decrease.
That's because some COVID-19 patients face lung issues from the virus, needing ventilation. But before placing the breathing tube, they first try alternative therapies.
Using a heated high-flow oxygen device. So we're providing high flows of oxygen, humidifying it to help the patients with their secretions. If needed, we give them nebulized medications and therapies to help to mobilize secretions and clean their lungs out.
Some signs and symptoms of COVID-19 include respiratory distress, tan or dark colored secretions, cough, fever, and headache. For more information and other possible symptoms, you can visit the CDC. For Newswatch 12, I'm Megan Mamlock.